Hey everybody, welcome to this episode of the Chiro-Factor. In this particular recording, what James and I did differently is we actually did this in front of a live studio audience. Now, if you want to be part of the audience, I'm happy to tell you we're going to do this workshop February 7th and 8th in London, and all of the docs that attend the Best Practices seminar can then be the audience for the Chiro-Factor podcast. Just to be clear, the Best Practices is a 2-day seminar. James and I teach side by side, totally consistent, totally complementary information of science and research tied into procedures that are based on philosophy. Also, we are happy to announce our March date in Australia. So our Best Practices seminar is going to be March 7th and 8th in Sydney, Australia. Now we expect that one to sell out because we've got a smaller venue. So if you're hearing this, please jump on it right away. Levelupmentoring.rocks is where you can buy your seats. Again, it's levelupmentoring.rocks. So if you want to hit pause, buy your seats, the venue is limited to just 200 people. So please take action. At those two events, February in London, in March, we will be in Sydney, Australia. We're going to do our Chiro-Factor podcast in front of that audience that attends the Best Practices seminar. So again, Best Practices is a seminar. This podcast, the Chiro-Factor, will be filmed live, very much like you're about to see. Super stoked and excited to bring this to you with James Chestnut. The audience was active, lively, and super fun. And you'll hear us talk throughout this podcast about growth and mindsets and things for duration and not to burn out. That's also why I teach my Speak to Attract Believers workshop, where you can get new patients in your community. And let's call it what it is. New patients always bring excitement and a lifeblood to the practice. While it's an online course, Speak to Attract Believers and how to do 10-minute talks and how to do corporate talks is all included in the online course. I am going to go to each continent once a year to teach this live, in addition to the access you get online. So if you want to do outside talks to attract new patients, now is the time. And I'm going to tell you, check out the website, levelupmentoring.rocks, because when you buy once, you get the online access immediately, and you also get seats to the seminar. I'll be in Sydney in November of 2024, and I won't be back till the end of 2025. I'll be teaching that workshop with a good friend, Martin Harvey. So if you want to join us for great communication, that will be in Sydney at the end of November. And then we are going to London in February for the Best Practices seminar. James and I teach that together. James and I will then be in Sydney, Australia in March for the Best Practices. And if you are there in the audience, you will also be there for the Chiro-Factor podcast. Without any further ado, we're going to count you into the live studio. We're going to take questions from the audience. We're going to get cards and questions throughout the day. This could be you. So bring your questions to the seminar. We'll put you on the podcast, and you'll get to go live and hear what's going on. And just fair warning, we definitely give the listeners a hard time, and the people who ask a question, we're busting their chops. So watch this one all the way to the end. You will enjoy it. Cheers, and I'll see you soon.
Let's fucking go. I think he's warmed up, ladies and gentlemen. All right. All right, we'll count him in. 5, 4. Hey everybody, welcome to a live episode of the Chiro-Factor. There's many factors in health, but we believe that there's one missing link, one missing factor. It's the X factor for people healing many times, and that's called the Chiro-Factor. As always, I'm sitting here with James Chestnut, and we've got a live studio audience. Let's hear it from the audience. So I'm super excited because we get to finally sit down and just kind of have a conversation, share the magic of what goes on. And really, I think it's a deep passion. So let's just jump right in where we left off, which is James is good and riled up.
Yeah. Brad was asking me about opioids, so I'm pissed off. I don't know, man. Do we want to talk about that on camera a little bit? Maybe?
Yeah, because I think, look, it's an opioid problem that people knew about. It was fundamentally overlooked on purpose. People were bought and paid, and we've got a crisis. And when they say it's an epidemic, I think that word is almost used. No, we have families destroyed, people dead, and it's in the name of profits. It's profits over people a lot of times with pharmaceutical companies, and certainly that has been the case with opioids.
Yeah, and I think the reality is that if we step back a little bit and we look at this and we go, well, why would we be surprised, right? So what happened with Vioxx? What happened with, go back to thalidomide? These people have been causing significant harm for decade upon decade, and are convicted felons, as Kennedy likes to say. And so it's like, the question is, why does it keep repeating itself? And I think there's two reasons for that. One is the media is bought from these people. And so, and really the trick is not that they're advertising their drugs, is that they literally own the programming. And so they're able to buy themselves out of consequences. And I think, if you can have kids without parents and finding their parents OD'd in cars, I mean, if that can go unpunished, and where's the uproar? Where did it go?
Right.
How is it possible that we've forgotten about it? Is it because it's the next new thing? Is it because COVID came along or a war came along? But how is it possible that we're sitting here today and there is no call for justice?
Right.
And there wasn't any call for justice after they lied about thalidomide. There was no call for justice after they lied about Vioxx.
Yeah.
Where's the call for justice when they gave immunity to vaccine companies? And I'm a fan of Ronald Reagan, but he signed that law, dude. He got lobbied and he signed that law. And so, the number of childhood vaccines that if you can get a vaccine onto the childhood schedule, it's billions every year recurring.
Yeah.
And how is it possible that we added something like, 20 vaccines, including Hep B for newborns, and the only way you get Hep B is through, sharing a needle or having unprotected sex. So newborns are usually pretty safe from that.
Right.
I mean, not my kids, but most kids are. and so it's like, when people ask me about this and I say, well, wait a minute, what were kids dying of in 1985 what illnesses were kids dying of that they required these vaccines to prevent in 1986? So what were kids dying of in 1985 where we had this incredible need for, 20 more vaccines?
Right.
And the answer is you can't find anything. There's nothing in the literature. There's no evidence anywhere that there was a pandemic or an epidemic of any childhood illness that required all these extra vaccines. So why did they come on the market?
Right. Right. And
what problem were they solving?
Right. It's a great question. And then you go over to something like Vioxx, which every drug that's ever been pulled off the market by the FDA was previously approved by the FDA. So Vioxx was approved to put on the market by the FDA. And then later they said, oh, wait, we got to pull it off. This isn't good. Well, what happened in between was thousands of deaths.
Yeah.
Thousands of people had to die before they said, wait, there's a correlation here. We might need to pull back on this.
And they still denied it. They still lied about it. They still got caught lying. There was still FDA capture. No one in the FDA got in trouble for also lying. Nobody got punished. Who got punished for Vioxx? Somebody paid a fine. That's not punishment.
Right.
Right? That's a cost of doing business.
Yeah.
So who got punished?
Yeah. And the FDA, the joke inside the industry is that the F is silent, because it's the Food and Drug Administration. They have about 4% to 5% of a focus on the food. It's all about the drug administration. It's all about pharmaceuticals.
And even the food is toxic as half the pharmaceuticals. I mean,
synthetic.
The whole, and not only that, but there's no, when they approve a food, it's not based on nutrient value. It's based on, hopefully it won't kill you because we've irradiated or put antibiotics in it or pasteurized it.
Right.
But there's no rules on whether or not it's actually nutritious for a human being. That's not how the food guide was formed.
Yeah.
So it's like,
and where this start kind of came from with our live audience is that we had a doc in the audience just say, listen, my dad died of opioids. These are some of the things that were in play. And then you kind of made a reference to in the session today about exercise and the benefits of it. So of course the opioids are bad. It's killing people. We now know that it has been recognized as an epidemic, probably 10 years too late. So all of that has happened, but kind of clicking it over to the positive side and the side of like, okay, well, what can we do as chiropractors? What do we do about this? So first thing I want to do is establish there is a problem. And if we don't put people on care plans, we don't get them chiropractic care, we don't change the narrative in their head, then that becomes their first outlet. They could be a statistic. Second thing is if you're a really good chiropractor, you're listening to this, we assume you want to get better, then take the opportunities you have and teach patients why they should be adjusted, right? Not so much the how you're going to adjust them, but why it's important. So let's maybe shift into the positivity on this topic, which is if someone's not moving, if they've got a opioid crisis or problem, addiction, what are some of the benefits of moving the body that go beyond just movement in general? What were some of the things that you were kind of sharing?
Yeah, and again, I think once you understand that the reason why people are in physical pain is, the inflammation, the lack of first of all, lack of motion. You get the scar tissue, then you get the inflammation, then you get the nociception, then that affects your moods, and then that affects your desire to move. It changes your food cravings, because then the nociception increases cortisol, which increases your cravings for sugar. I mean, it's an incredible downward spiral, right? So there's a couple of things I think chiropractors can do. But even before I talk about movement, it's like, well, why is that person taking opioids? What is the problem that they're trying to solve? Mm-hmm. And what problem can an opioid solve? An opioid can numb you. That's it. Right. And why would they prescribe heroin to numb you? Because the NSAID and muscle relaxant and Tylenol they prescribed to numb you didn't numb you. Mm-hmm. So you need more numbing. Mm-hmm. So I'm not sure if numbness is a good outcome goal for healthcare, right? But it's the only possible outcome from that. It's not. It doesn't make you move better. It doesn't heal you. It doesn't make your bones better. It doesn't make your muscles better. It doesn't make your brain better. It doesn't make your sensory motor cortex better. It doesn't make your balance better.
It's not stimulating stem cells.
What does it make better?
You're numb.
It makes, what it makes better? It makes better your score on a visual analog scale. Just like what does a cholesterol pill do? It makes your score better on a cholesterol on a cholesterol level number. What does a blood pressure do? They don't actually do anything for health. They just change a score. So if the opioid changed a score, they thought that was a positive outcome. Right. So you got a numb person who filled out a visual analog scale differently. So anyway, so the idea for these people, and again, it's unlikely. I mean, it's unlikely that the guy went straight from, I'm really healthy to I need an opioid, right? There was probably a lot of opportunity for someone to get in there before that, right? For most of these people, right? They don't just jump straight to opioids. And so... And
I'm going to suggest chiropractor. This is a chance for a chiropractor to
do 100%. Yeah. And it's like, hopefully you get these people before they're, when they're kids, and you can start teaching them about the chiropractic lifestyle. But the reality is that I think we have to recognize that there is no chance to get better in that system. It has all the cultural authority, it has all the monopoly of reimbursement, but listen carefully, there's no chance to get better in that system. And we know for sure there's a very good statistical chance of getting better if you go to a chiropractor. So I think what chiropractors have to understand is that, look, sometimes I think it can feel overwhelming for someone who's really sick, and they come to a chiropractor and you're like, I don't think I can solve all of your problems, right? Because they've got, they're maybe be overweight, they've got blood sugar problems, they've got, some heart disease. Like if you think of what most people are suffering with as adults now, it can feel, I think, at times overwhelming for a chiropractor until you understand that the basis of all of that is inflammation.
Right.
And one of the largest drivers of inflammation, of course, is lack of movement. And then when you start to move, you get those myokines released in the muscles, not just from the adjustment, when you get them to start walking around. So one of the great things that you can do for people in their lives to turn their lives around is to increase their level of movement, because it changes their moods, it changes their hormonal profile, it changes their gut probiotic profile, it changes their inflammatory profile, it changes their immune profile. Movement is significant. So sometimes all that people can do is just get adjusted, but that's more movement than they got before. Right. But what if they could get adjusted and then be comfortable enough to go for a little bit of a walk, or at least learn why that's so important and what that can do for them. Then they get the essential nutrients and they can start to resolve the inflammation and feel better. So, I mean, if you understand why these people are sick, then you can understand how clear it is what is required to get them and keep them well, and how important chiropractic and movement is as part of that equation.
Let's kind of unpack that a little bit. And I know it's a big task, but most of your patients are going to be in an inflammatory state. Most of your patients aren't going to be moving. And I want to talk about movement in two ways. One, segmentally in the spine, or globally, but still in the spine. So movement meaning segmental movement of the vertebrae, because we know what that does to the brain function, right? Number two, movement being exercise, like getting up and moving. You need to do that. You said something today in the best practices seminar, which is each joint every day should go through a full range of motion against resistance.
It has to, or it degenerates, starts to die.
I think that's also foundational. So we're talking about spine adjustment, segmental, global, and each joint full range of motion against resistance. So that's a huge segment we just kind of pulled out of the suitcase. Like if we're going to unpack this, chiropractors need to know that. Chiropractic students need to know this. Number two, we talk about the inflammation and the benefit of exercise, walking, movement, just a sustained movement pattern. There's a lot on phase 2 exercise, and just kind of getting your body moving, what it does for the resolving pathways. Because some people might think, well, if they're inflamed, give them Advil. Why is Advil or an anti-inflammatory, if you're in a country where you don't have Advil, why is just taking the shortcut of an anti-inflammatory different than activating resolving pathways?
Well, inflammation is an immune response, right? So basically chronic inflammation is a chronic, sterile, basically non-pathogen inflammatory immune response.
So differentiate that for me too. What's the difference between pathogenic inflammation or infection?
Pathogenic inflammation would be you got the flu or a cold virus, or you have a systemic infection, right? So your body, you get a cut, you get an infection, your body creates an immune response to it, gets swollen, it gets sore, and that's basically the healing process taking place. So most of that gets resolved. It's very rare
because it's short term.
Yeah, and there's very rare that someone has a chronic infection that's causing their problem.
Which would then be long term.
Yeah. So most of the heart disease, diabetes, cancers, all this stuff, when they talk about chronic inflammation, what they're really talking about is they're talking about chronic, basically systemic inflammation that has nothing to do with an infection. It's basically caused by an overreactive immune system. It's not really an overreactive immune system as it is an immune system that does not have the checks and balances in place because they're lacking the nutrients and the essential nutrient. And by the way, movement is an essential nutrient, right? Some kind of positive self-esteem is an essential nutrient. These things all are very highly related. The probiotics in your gut are essential. The omega-3 and vitamin D and all these things are essential. So if you don't have those things, your body can't resolve inflammation. In a healthy person, if they get cut, or if they get, or if they hurt a joint, what happens is they get that immune response. It starts the healing process. All the good stuff like leaks out of the blood vessels. You get the inflammation, and then what happens is that the resolving pathways kick in. But those resolving pathways are highly dependent upon omega-3 fatty acids and vitamin D and movement. So you can't heal a joint without movement. If you just keep a joint passive, there's no way that joint's healing. That's why when you get out of knee surgery now, you're actually in a motion machine. They realize how important this is because motion stimulates blood flow, it stimulates nerve flow, and it stimulates changes to the immune response to move from the emergency acute inflammation into the resolving, repair, remodeling that I think chiropractors are pretty familiar with.
Yeah, but I think it's important, repair, remodeling, because and we also know if you put an arm in a cast for a month, it's going to come out smaller. It's called atrophy.
Correct.
Yeah.
And the part of your brain that controls that is also going to shrink. Right, and your motor control of that limb is going to be different, and so, everything's different about it. So the idea, what NSAIDs do is they are anti-inflammatory, meaning they do stop some inflammation, but they also stop the resolving pathways, right? So they mess up all of it,
right?
And so that's why you get a short-term little bit of a relief, and then they stop working, and it actually makes it worse. They actually delay your ability to heal, and there's all kinds of good evidence on that. But you can't heal anything without movement. And I just want to talk a little bit about what you said about like segmental and global movement. But movement is just dose responsive, right? So a segment, if I move this, that has a different dose of input into my central nervous system. That has a different dose of myokines. Has a different dose of everything than if I move this, or if I move this. But if I move this, right? So there is no global movement or exercise without segmental motion. It's impossible.
Right.
And even if that's just your spine stabilizing, it's slightly moving and things are contracting and you're getting proprioception. So what's really interesting from a chiropractic standpoint is that the dose response for exercise is based on the density of proprioceptors. Well, guess where the highest density of proprioceptors are?
Paraspinal.
And in the spine, guess where the highest concentration is?
Further up.
Upper neck. And in the extremities, the ankle. It's the upper neck of the extremity. So adjusting somebody in the spine or a lack of proper proprioception in the spine is much more devastating than a lack of movement in the extremity. Now, you're still getting the inflammation, you're still going to get nociception, but the amount of proprioception that's lost from a lack of spinal movement it's a much higher dose.
Right.
And so it has a much greater impact on the entire ecosystem, because without that movement, we know that now you're going to change. What happens in the hypothalamic pituitary adrenal axis. The movement actually stimulates parts of your brain. Proprioception is a positive body signal, right? It's a positive body emotion. And movement, proprioception literally goes to the same part of your brain where a positive thought goes. And it produces the same hormones that feel good. Everybody knows if you feel happy, is your immune system better or worse?
Better.
Right? When you're in a good mood and you're in a positive mental state, what about your gut? Everything changes, right? So that's what movement does.
Right.
Movement literally shifts your whole body towards a parasympathetic healing state.
And I think everybody has experienced moving, exercising, and then feeling better afterwards.
Yeah,
you could call it the runners high, you can call it the endorphins, but the truth is, the fact that it affects that part of the brain, I think this is an opportunity for our listeners to be better than even the medical professionals, because you realize that stimulates the same part of the brain from proprioception and the positivity. So
and it inhibits the negative thoughts, the negative body thoughts and mental thoughts. And, the endorphins is kind of like the old school stuff. They thought you went for a jog, you got some endorphins, you kind of felt better.
Right.
But we know so much more.
And that's what I'm saying. You can be better than your medical doctor, right? It's like, you got a runner's high. It's like, it's more than that. We're going to talk about the neurology. This stimulates the brain, the proprioception, the positivity. Because it's the same area.
Just Tai Chi, get up and moving around, will have an incredible impact on your mood, on your ability to have a bowel movement, it changes your neurohormonal profile. There's a million things that'll change even without getting your heart rate up, right? Proprioception by itself. Now it's good to get your heart rate up as well, obviously, but I think there's a guy by the name of Jensen who wrote a couple of really books. One is Learning with the Body and Mind, and he talked a lot about the research on like little monkeys as an example. If they have a choice between a fake mother that feeds it and a fake mother that rocks it, they go to the one that rocks it. How that you literally don't develop the self-control pathways in your brain, or the learning pathways in your brain if you're not getting movement. So these kids who miss out on physical activity, they actually don't develop their intellect as well. There's a book, Spark, by Ratey, Ratey. It was a fantastic book, a neuroscientist who talked about how he prescribes movement instead of antidepressants. And he told a really cool story about a gym teacher in Chicago where he was at an inner city school where they had the lowest scores, not just in their district or their state, but amongst the lowest scores in the country for math, science, and I think English. And so this guy he was kind of old school, had the whistle around the neck, like yelling at people for not working hard. And so he went to a conference, and he just by happenstance won a bunch of heart rate monitors. Very poor school, they couldn't afford it, but he won them. So he put the heart rate monitors on these kids. And what he found out was these kids were going around the track, the ones that he was yelling at had a higher heart rate and were working harder than the ones that were in shape and jogging. Completely changed his mindset. So he started being more encouraging for these people and giving them feedback of how hard they were working, how great it was. Well, he ended up starting a walking club. So they would come to school in the morning, they'd walk a mile, and it really caught on. Well, that's the only change they did in the school. They went from the bottom in the country to near the top on math, science, and English.
Crazy. You mentioned coaches with whistles being old school. Do they make them any other way? Is there a different kind of a coach?
Have gray shorts with the ass sweat stain and whip the kids with the keys. I mean, come on. That's Jim.
Yeah, that's it. Exactly. Spelled with a G. Right? Yeah, exactly. Yeah. Okay, so kind of finishing on this continuum, we talked about opioids, worthless, timeless. It's just going to numb you. The only rating scale they have is how numb are you. So we got to get out of that.
The best case scenario is you're numb.
Best case scenario. We talked about movement, segmental, global movement, what that has for proprioception. I love that proprioception and positivity land in the same part of the brain. So where this conversation is better than what a medical doctor could have or any other cultural authority in your area, your community, is that actually, no, there's a higher understanding neurologically that actually movement stimulates the same part of the brain as positivity. So proprioception equals positivity. Said differently, movement equals neurology, right? We've always been teaching that. Yeah. I want to take this one step further. So the activity-wise, they get up and they exercise. We know that stimulates things inside the body. We know that creates the resolving factor. Let's go a little bit further, because if they're stuck in this opioid paradigm, sitting on the couch, not moving, and that again is the question that we got. And then we get into segmental movement and then into exercise movement, whole body movement. There's this other thing that if they're stuck in that mode, we mentioned increase in cortisol. We mentioned increase in nociceptors. Can you help our listeners kind of delineate the difference between allodynia and nociception, because I think that's a profound concept that you fully understand, that anybody listening, this would be like a stop the tape, you're good to go home right now. It's really important to differentiate those two words.
Okay. Well, first of all, nociception, interestingly, is a negative body emotion, and it goes to the same part of your brain as a negative mental emotion. So movement, like the body and the brain literally meet. They're one. They're in an indissoluble union. It's incredible. Yeah. Mary Ellsworth taught the thinking body. Like there's just so much work on this. So nociception is also pro-inflammatory, right? And it fires off all those things that are going to move your body into not just a sympathetic dominance, but an inflammatory dominance, right? Which is the basis of all
chronic inflammatory
illness, right? Yeah. Chronic inflammatory. So the difference between nociception and pain, is that the question?
Yeah.
Is that nociception can occur with or without pain. Pain is the emotional response to nociception that reaches the part of the cortex that's in charge of pain. But pain is an emotion. Even that's indisputable. Even the new pain guidelines, the Pain Society came out and said pain is an emotion. So you can have, think of people that you x-ray, right? And their spines are like a degenerated, inflamed mess, and they don't have any back pain.
Yeah.
But they had nociception. So that nociception was going, because nociception does not have to reach the cortex. In fact, most of the nociception does not reach the cortex. It sticks around in the subcortical areas, like the amygdala, the locus coeruleus, the hypothalamus. So when you've got nociception pouring in, you are literally having those negative body thoughts all the time. But what's interesting is, so if I were to ask the audience, what kind of hormones do you produce with negative fear and anxiety and depression? What kind of hormones are going to get produced in your body? Cortisol, adrenaline, right. So what do you think gets produced from a negative, from body anxiety, from nociception or subluxation? Exact same thing. What does that drive your immune to do? It drives towards pro-inflammation, downgraded your immune response to viruses and to bacteria, changes your gut flora, changes your gut, the leakiness of your gut. It changes vagal, efferent and afferent, same kind of safety pin cycle. So that's nociception. Nociception can occur with or without any conscious awareness of it. And so what's really interesting is that, but what's real, the thing to add to this, I think, is allodynia.
That's what I was asking.
Yeah. And so those people, so when you have a toothache, I like to use the dental analogy, but when you have, say, a tooth and it doesn't hurt, and then you go to the dentist and they put cold water on it. Sometimes they'll spray cold air on it just to test it. And you're like, oh, that's, ow.
Is that what you say? I'm just like, fuckers.
Yeah.
I'm way less polite.
Is your mother so? Have her stitch that then, So what that's telling the dentist and what the response to our touch that's painful is telling us is that there's inflammation there. And that inflammation is very likely not new, because they have a sensitized nociceptive symptom. If it's new inflammation, it will hurt. They'll have pain, right?
Yep.
If it's old inflammation, they'll have allodynia, most likely, where it doesn't hurt until you touch it or they move it. Mm-hmm. And like the tooth, if that tooth is sore when you put hot or cold on it, that tooth is dying. Mm-hmm. Very often you end up saying, oh, that's the root canal sign, right? Where it means that it's been decaying for long enough that it's actually caused severe damage, right? And so that's what, so allodynia is when a non-noxious stimulus creates a noxious or painful result.
Can you just say that again? Because I think that's profound. And raise your hand in the audience if you found that to be profound, just that understanding, which is why we do a touch and tell on the day one.
Yeah.
Why your palpation for your table talk is important. So if I can just have you kind of do like a double click on the allodynia, just explain the noxious and non-noxious stimulus.
Sure. So nociception is the detection and transmission of information related to tissue damage or tissue stress or tissue inflammation. Right, it's just it's a chemical depolarization of a receptor, and then that message travels in the nociceptive pathway in the spinothalamic tract. It's not pain. There's no pain anywhere. It may reach the part of the cortex that you could perceive it as pain, but it may not. In fact, it usually doesn't. Okay, so that's nociception, and that's pain, the emotion. Allodynia is when you've had chronic inflammation, usually from in a joint, it's going to be from lack of movement, scar tissue adhesions. Then you start to get the prostaglandins and the inflammatory response, because your body recognizes lack of motion as it requires an immune response. Mm-hmm. It's actually literally it's pathogenic. It's like, that's not normal. We got to get in there. So whether that's lack of movement because you hurt it, or whether it's lack of movement because you just don't exercise at all, you sit all day, that's recognized from your body as a threat.
I love that additional layer you just put on that. That's huge. It's a threat to the body. Lack of movement is also a threat.
Because
that speaks volumes.
It results always in scar tissue adhesions within a few hours. You can take an Olympic athlete, and if you put them in bed rest for one day, you can actually measure the changes in their blood sugar levels, their insulin response, their inflammatory response. All of it is changed within one day of bed rest. Lack of movement. It's incredible how, so you take out movement from a human being, and they literally shift hard.
I jumped in too soon. Finish that definition of allodynia.
Okay, so allodynia is when you have underlying inflammation, which results in a non-noxious stimulus like touch or movement, causing a noxious response like pain or tenderness. And so it's not painful when you're sitting here, but if I come and touch it, the tooth's not painful till I put cold or hot on it. It's because there's underlying inflammation and degeneration occurring, which makes that nociceptive system sensitized, meaning you need less stimulus to depolarize and fire that pathway, sensitized. And so that is a absolute valid, scientifically validated indicator of underlying inflammation. And that's what a subluxation is. Subluxation is an inflamed joint that's not moving.
I love it. I think that's going to be huge for the listeners too, just to differentiate that and understand that when you palpate, you go hands on and all of a sudden it hurts and they didn't feel it. Just knowing that that's allodynia and just going, hey, listen, this is a problem that has been going on.
100%.
And this idea that it's about to get worse, there's so much in dentistry that translates to chiropractic. When they put cold water and they go, oh, I'm going through the roof, they go, okay, well, that tooth has been dying. Usually what they'll say is it's in its final days. Yeah. Like it's a near death right now. And it's the same thing with the subluxation. You put pressure on it, all of a sudden it sends somebody through the roof. That isn't the first time they felt it. It's been going on for a while. So the non-noxious stimulus could be palpation. The noxious stimulus is extreme pain. That just means it's been chronic. There's been inflammation going on.
And here's what's interesting about the allopathetic, as you put it, or the allopathic approach. The allopathic approach is to get people to avoid pain. So pain avoidance is literally the strategy.
Yeah.
Right? Oh, if that hurts, don't do it. And so what they do is, what people naturally do is they stop doing things that aggravate or create allodynia. So if moving your knee hurts, you stop moving it. If walking hurts, you stop walking, right? If exercise hurts, you stop exercising.
So this, I think, becomes the full illustration of one of the docs that asked us off camera, which is basically had a father addicted to opioids, eventually killed him at 65, too young of an age, wasn't able to move, wasn't able to exercise. That breaking out of it would be getting adjusted, getting better movement, getting the endorphins, increasing proprioception, which would increase positivity. And I'm not saying that's 100% of the problem and it would be all gone. But if chiropractors want to know the pathway to get there, these are the steps that have to be done. And then recognizing that the allodynia has been a chronic inflammation, which means it's probably systemic. It's probably the whole spine's got inflammation around it, and movement.
Yeah, not just the spine, but if your spine's inflamed, it means that you've got chronic inflammation everywhere. 100%.
And something you and I have talked about many times is worth repeating again is there is no peripheral nervous system and central nervous system.
Yeah, no. And the thing about, because I want to go back to the opioid, is that's why the essential nutrients are so important, right? Is because no matter what, you can't resolve that. An adjustment can't resolve inflammation if there's no vitamin D and omega-3 in the system. It can't. It's not possible, because those pathways, those resolving pathways, require motion and the nutrients, right? And if you're just getting the nutrients and not getting the motion, the same thing. You can't resolve it. Yeah. These are things. These are physiological hard facts. Is that you can't produce those merisins and the resolvins, and you can't get your T cell, your T regulatory cells. You can't, switch the macrophages from M1 to M2. Like, none of these things can occur. They're all biochemical, and they all rely on biochemistry of vitamin D and omega-3, and they all require movement, right? Because movement stimulates. They require the stimulation of the movement is involved with. Then the biochemistry comes in. So. There's just no possible way to get around it. So I think, it's incredibly important, especially say for somebody, if someone said to me, my dad's on opioids, he's still alive, but my dad's on opioids. What would you do? And I'd say 100% I can help. 100%.
Keep going with that, because I think this may be like the cherry on top for the conversation.
Well, it's because I understand why they're seeking opioids, right? And they're seeking opioids because they're so chronically inflamed. And so right away, I would get in there with the essential nutrients. I'd go omega-3, vitamin D, and probiotic, and then I'd start getting them adjusted, and then I'd start getting them moving, and I would explain to them that the pain that they're getting from moving is a feeling of that's healing. Like that's literally that's that thing that's telling you that you're getting better, because it's sore because you're moving it. Sore from movement is life. Sore from being still is death. Right? So if you're getting sore from movement, take pride in it, understand it, understand that you're moving in the right direction, and just understand that if you take that movement and you take these nutrients and we just do baby steps, whatever it takes to get you up and moving, I promise you, I can in fact guarantee you that you're going to get better. But if you do pain avoidance and you're sore from lack of movement instead of sore from movement, you have no chance. If you're not willing to go through some discomfort from movement, and you're going to avoid movement and avoid discomfort and try to numb yourself, that is a path which is an inevitable conclusion.
Yeah.
It's inevitable.
I think we saw that in the conversation with the doc in the crowd, same thing. Yeah. A good example of this, kind of to tie this up in just 2 minutes, it was a patient education thing I used, and also it helped us get a talk in our community. We had a woman who came in, and she was the head of the Naples Island Gardening Society. At first I was like, the gardening society? I'm like, what is this? And she's like, oh, it's just a bunch of us old rich women that get together and hang out. I'm like, I'd like to do a talk there. Yeah. You know, she's like, we have disposable income and lots of time. I'm like, perfect. My 10 a.m. slots are open. You know, it's like, and she was talking about, what else can I do to speed up the healing process? And I'm getting adjusted, but I'm also doing some, she was talking about doing water aerobics and things that I want to do. And so I kind of took a step back and I just said, okay, well, if you're the head of the gardening society, what are things you need to do for your plants? Well, sometimes depending on what we're growing, there's, structural things you need to do to give it support. And then there's things that you can do if there's been wind affecting it. And it's really cool, some of the different techniques, but it always depends on the plant. And I said, let's just stop right there. So if it always depends on the plant, one of the things I need you to do is get out of the pool. I said, buoyant exercises at your age is not a good idea. You need weight. It's Wolff's Law. Bones that are stressed lay down more bony trabeculae. That increases your bone density. You going to the pool possibly could be increasing osteoporosis. You need to get out of the pool, get weight bearing. That's what you need to do, number one. Number two, if you're trying to grow things in the soil and it doesn't have the nutrients in the soil, and she cut me off, it was like, oh, that's a big problem these days. A lot of the farmers are noticing there's not the nutrients in the soil. It's not the same stuff. I said, so how healthy is the plant going to be? And she said, well, it's almost doomed from the start. And so to this idea of having essential nutrients, like if you don't have the building blocks, it's going to have a limitation that it can grow, right? And very much like the immune system, very much like your response, the resolving factor, inflammation, if you're not putting the right stuff in, I think this is obvious to our listeners, but the body's going to be handicapped from the start. Right? You're going to dramatically decrease the healing potential. So what goes into the body, what goes into the mind is there's essential things that need to happen. There has to be positivity. There has to be these essential building blocks. And then we can get into some of the other things that have to do with health. But it really made sense to her. And then we went and we did this talk and we crushed it. We signed up a bunch of patients that were cash paying patients with, as I mentioned, disposable income. So that was always nice. Yeah.
That's my demographic.
Yeah, it was just fun because it was like, they came in and had nothing to do with money. It's just, could you help me? And it's like, what a refreshing report of findings. Money's not an obstacle. And it's like, they always tell doctors, like, if money wasn't an obstacle and you could 100% recommend what you wanted to, what does that practice look like? And you see chiropractors light up, they're like, that would be amazing. I'm like, take that attitude in there. You don't know that money's an obstacle. You're putting it in the report of findings when you just need to assume they have the money to do it. Now, what would it be? And the truth is better health. The result is better health, better adherence to a plan, and you're going to get people, really blossoming and kind of going to a whole different level under chiropractic care, knowing those 3 phases that we just went to. And if you don't, there are also consequences, meaning they don't stop looking for a solution to the problem. They could go back down the street and wind up with the opioids. So work with that sense of urgency, work with that mindset.
Yeah.
Any final questions? Anything I should have asked you? But we're going to open it up to questions later with our audience. But any final thoughts or things you want to add to that?
I always like I love your idea where you ask the patients at the progress exam, what's a subluxation? I think it's worth asking what an essential nutrient is. You know what I mean? I mean, I don't know how many questions you want to ask on that, but I've always thought that, or maybe a Hilton's Law question, or because that means they're understanding what you're doing. Right?
Yeah. So to James's point, on our re-exams, we always ask them what a subluxation is.
Yeah.
And there's a number of docs sitting here today. Raise your hand if you found value in that question today, just from hearing that, right? Just what is a subluxation? If that's the thing we're working on, well, they better know what it is. And if they look like, I've never heard of it, grab a seat, time to talk, you need to do that, number one. Number two, I'm going to tell you, keep your re-exams flexible. Keep all of your practice flexible. If you learn something better and you want to ask a question on there, then change the format. So I'm giving you permission to ask that question too. Ask them what an essential nutrient is. It's okay. Keep practice fun. Nothing says you got to lock your forms in for the next 20 years. Right. It's flexible. Have fun. What did you learn this week and that's of interest and you're going to change Monday? To me, that's a more interesting practice than I got everything set. I don't want to change anything. How boring. So it's okay to ask multiple questions, but I think one of them should be, 100%. What is a subluxation? Yeah. And if you're listening to this and you consider yourself principled, vitalistic, you're trying to become more in the salutogenic model and away from the allopathetic model, then have the courage to ask the question in the re-exam, what is a subluxation? And the feedback you get is the litmus test. It's easy to tell yourself, we're teaching people, when you hear what they know or a lack thereof, they don't know what it is, okay, you got to up your game. You got to do a better job.
It's revealing. And the reality is, if you're doing the spinal health assessment or a proper exam, you would hope they've heard of it.
That's right.
Right, and so if they should understand why it's worth paying to fix. Right? And if they don't understand why it's worth paying to fix, it's unlikely you're going to keep paying to fix it.
And if you don't want to talk about pain, but you keep asking about the pain on the re-exam, there's your contradiction. And then you try to re-sign people who don't have pain, and it doesn't make any sense because that's been their tracker the whole time. So there is a way out of that model. There's a way to do that. And it's been super fun today, day one of best practices. Yeah. Audience, did you guys get a lot out of it? Yeah. I want to hear it from the audience. Was that good today? Right on. Cool. So what we're going to do is we're going to take some questions from the audience tonight, and then we'll answer those questions tomorrow. We'll kind of put these two pieces together, what we just did and then your questions tomorrow. And when we go to the UK in February, we'll do something similar. We go to Australia, we'll do something similar. So start formulating your questions tonight in the audience. If you're listening at home, same thing, start formulating your questions. And I'm looking forward to that because some of the best stuff we've got is off-the-cuff riffs, but we'll do a quick shot clock. We'll do 4 or 5 minutes. So we'll just get through the answer. And I think it's going to help a ton of people. I always have appreciation for working with geniuses. If you guys would indulge me, if you would just give some love, noise, and appreciation for James Chestnut. This guy crushes it. Yeah. He's
hang on, come on, give it up for Brad. Hey, not that much.
All right. Not a popularity contest, middle of the road. All right. So listen, tomorrow we're going to come back with the questions from the audience. When you see us live in the UK or Australia, we'll do the same thing for you or back here in the US. But as always, it's fun sitting down with Dr. James Chestnut and many factors in health, but the X factor, we all know it's the Chiro-Factor. Thanks for joining us. For the studio audience, let's give it up one more time. Thank you, guys. And if you want to get sneak peeks of these podcasts before they drop, then follow me on Instagram at Dr. Glow DC. That's my handle on TikTok, Facebook, and again, Instagram, Dr. Glow DC. Hey, we are just on our last break of the day here at Best Practices. And I just want to get James's input because I know I'm loving it. I talked to a number of doctors just now that are out of their minds excited about it, but I want to get your interpretation.
Well, Chestnut was boring. Glowaki was on fire all weekend, but I think it's what we hoped it would be, to be honest. And more importantly, I think it was what the folks who took the time to get here, it was what they hoped it would be too. So we had fun. We did the live audience thing with the podcast, and we're going to do that in the UK as well. And so I guess we'll see you February.
Yeah. UK in February.
Get there. Bring your CAs for sure. That's one thing I heard actually from 2 different people. They had wished they'd brought their CAs. I know some did, but so definitely bring your CAs.
Yeah, and to me, the podcast, we did it with a live studio audience. I encourage you to be there. We took some questions from the audience, but they were also in it, and just got to see how organic our rift is. We're just oozing chiropractic, and it's rubbing off on everybody around us. And if that's what you feel like you need, or you've been on your island, or you've been kind of beat down the last 4 or 5 years since lockdowns, come to this event. It is not just the validity and the science and the research that we all need. It's also where to plug it into your practice. So you're going to get validation and application, and we're going to do it at a really high level, which is what we're just kind of wrapping up today. So see you in the UK, Australia. We're going to announce your date soon. But get there, bring your team, and we'll do a live podcast in the UK. We'll also do a live podcast in Australia, so you can be a part of the show as well.
Yeah, it'd be March, right? Australia, March.
Yep. And we're going to release our latest Chiro-Factor 2 that we did for the live studio. So that was pretty fun.
That'd be fun.
So we'll see you there.
All right, ciao.
All right, everybody, we're going to have some fun here, something we've never done with a live studio audience. If you're in the audience, put your hands together. Let's make some noise. So this is day 2. We just got done with both days of the best practices. Strongly encourage you to get there. And what we're going to do now is something we haven't done, which is basically a live studio audience to ask some questions. They filled out some cards last night. Anything that was on their mind, we went through. We're just going to hear from the audience, which is probably a good sample of listeners on the Chiro-Factor. And first doc up is Ryan Carlson. He's going to ask his question, and then we're going to go through. We've got a CA that's going to ask a question, some other docs. We're going to have some fun here, and we'll see how long this goes. And time provided, we'll get through a few different people to get up here and ask some questions. So, Rhino, what is your first question?
All right. Well, I would consider myself still a young doc, and both of you have a little more experience than I do in years.
How old are you?
I'm 30. I just turned 32. Yep, just turned 32.
Yeah. Okay.
So we won't make you say your ages, but you've got a little more experience than I do. So what are some things that you've done in order to make sure that you're kind of getting out of the monotonous day-to-day with chiropractic, and just keeping that attention level high and keeping that intention high as well, to make sure that you're not losing focus on the most important things with your practice and your patients?
You want me to go? Yeah. You know, if anybody's ever had a dinner with me, or been in my home, or been on a flight with me, or anything, what you realize is that it's a life, right? So I'm no different off stage than I am on stage. I'm no different in my clinic than I'm off clinic. Like, for me, it's it's an enormous amount of, I guess, it matters to me. Right, what we do and what we represent, and what the consequences of us not winning this colossal battle for the hearts and minds of people in terms of what they're going to do to get and stay well, and to battle this this cult of drugs and surgery, which is literally destroying a generation of people, and is harming, probably maybe permanently in some ways, the human race, literally, right? So I guess for me, it's like when something matters to you that much, it's kind of like you don't need motivation. So I've never really thought to myself, like, should I keep doing this? I like the travel. I don't like being in front of the audience and dealing with chiros, and being around chiros I love, right? But I just think once there's a switch in you, and the switch for me happened very early on. I had a special needs patient when I was in clinic at school. His name was Hassan. And one of the clinicians, he was just a dipshit, basically just kind of made some disparaging comments about my patient and about whether or not he still needed care. And anyway, it's a long story, but basically for the first time, like, I didn't need it. My numbers were done and all the other stuff. And so what I realized for the first time was that I literally almost beat this dude because he was trying to deny my patient care, not deny me the right to give care. I didn't need to. My numbers were done. And I think that was the switch for me. And since then, everything I do, every time I read a paper, every time I give a talk, every time I'm writing something, I'm always about how important our message and our interventions are to humanity. And so motivation's not an issue. And I wasn't at 30, maybe if I was 31 and had the long flowing blonde hair, curly hair, and, was seeing 500 a minute, you know what I mean?
Yeah.
That probably maybe I'd be done by now. I might have retired at 33.
Yeah.
But, and the other thing is that when you see someone that your age who's doing so well and following, basically like as Brad often says, success is formulaic. And when you see that and if I ever get down, it's that 50% of chiros fail, right? Like that gets me down, and the debt they come out with. And when I see chiropractors are down and they don't love what they do and they're not excited about who they are and about their talent level and just how much they have to offer and how much they're worth, the value that they bring to it, that sometimes gets me down. And then, so it is nice to meet young, successful docs who are excited. And what I'll tell you is, you will never have an issue with your motivation, right? You might have an issue in that, it's hard to go up. So you're going to end up helping other chiros, which is what you started to do. But that's what happens. That's the progression, right?
Yeah, awesome. For sure. Yeah, and just so you know, if you're listening to this, you're listening to Ryan Carlson. He was an associate in my practice. We co-teach together the Elements of Closing workshop, and he just got done speaking here at Best Practices. But one of the things Rhino's done is collected $1 million in his first year out, and he is an ethical millionaire, right? Like just doing it the right way, having the wellness patients coming in, yeah, for sure. But also humble enough to ask the question of how do you stay on fire? Part of why we do this podcast, like there's no fee with this, is we want to help other chiros. Like that's always been a burning desire, I think, for both of us, is just how do we give back? Because we're driving on the same road, and at some point people paved this for us, and if we can make it better for people behind us, that's always the goal. And that's super rewarding. You look at the jobs that are most rewarding, it's always when people help other people.
Right.
And here we are in this position to help our patients, and then James and I get to do this and help other chiros so they stay on fire. And similar story, I mean, I was 6 months out of school and in practice, and I was doing a spinal screening, and they had a bunch of these pill bottles, prescription bottles, but they were filled with candy. They were filled with Skittles and M&Ms. And it was a corporate family health fair on a Friday afternoon. All these little kids were popping the top of a prescription vial and eating candy and throwing the prescription vial. And I lost it. And I threatened the guy who was a pharmaceutical rep. I said, if you don't get this thing out of here, I'm going to pull that jacket over your head and I'm going to beat you like a piñata. And not my most professional move, but it was just one of those. Like I had a visceral reaction. I was sweating from my shins. It was like, I was like, what in the hell? Like, is this really healthcare? And I was so naive in school. I didn't know the other side. So I always say, you got to wow people to life. But I also know that pharmaceutical companies provide death in many cases. And so they have to try chiropractic first before they take those pills and drugs. And when I unfortunately threatened this guy, he just said, you don't get it, dude. All kids are going to wind up taking medication in their life. We just want to show them it doesn't taste bad. So when they get a prescription, they just take their medicine, no questions asked. And so to me, that was definitely, I had a pivot point too, where I was just like, all right, that's it. So I think your purpose, your drive is one of those big things. And for anybody listening, maybe you have that pill bottle, maybe you have that patient in clinic, but that's what I would call an anchor. And I think everybody has one, or as a practicing doc who still is adjusting, you need to get one. Could be a picture of BJ Palmer. Certainly it could be a family photo or something like that, but I'm going to say make it different than that. Make it about the daily visits, make it about adjusting people, make it about something chiropractic, not so much family, and I love my crew, but make it about chiropractic. And for me, I still have the pill bottle on my desk, and I rattle it before I go on each adjusting shift, and I get the chills, and it puts me in state. And so to me, I just think find what's known as an anchor before you go out that keeps your vision big. And like anything, if you have a big vision, you're going to have big energy. Small questions yield small energy. Big questions, big vision, give you big energy. And so for you being 32, I know your numbers, he's collecting over $2 million a year and helping a ton of people. It's just keep teaching, keep going bigger, and just keep helping more people out, and just show people it can be done. Because certainly we're going to pass the torch at some point. I think that becomes super important to have guys like Rhino doing that.
And I think, Ryan, one thing that I sometimes overlook, and what Brad and I do is Brad and I get a lot of fellowship because we travel around and get a lot of love. We give a lot of love to and receive a lot of love from a lot of other chiropractors. Mm-hmm. And I think the hard thing is not maintaining the passion for chiropractic, but it's hard to do it on an island by yourself, right? Mm-hmm. Like everybody needs fellowship of like-minded people. You need a tribe.
Yeah.
And I think that's one of the, when Brad was first trying to twist my arm about actually leaving my house to come out again and start
Which is
speaking,
true,
right?
true statement.
And I said, well, then what the big thing for me is I want to create a tribe of successful chiropractors that don't feel like they're out there against the world by themselves. Yep. And I think that's probably a bigger part of it. Like, you're highly internally motivated, but it's still lonely. It's still hard to do it on your own. There's a lot of shit you have to deal with as a chiropractor, and I think we definitely need to be around each other.
Yeah.
So well said. Thank you.
Totally agree. That was Dr. Ryan Carlson. He's from Bentonville, Arkansas. Thanks for doing that, Ryan.
Absolutely.
All right, let's hear from the crowd. Aaron. This is a CA. Aaron Ennis, put your hands together. Let's hear it. You can just ask your question,
Okay.
but it's there in case you forget what you wrote down.
Okay.
And I know I didn't prep you. I didn't want to make you nervous.
Okay.
We just thought we'd throw you in and make you nervous this way.
Perfect.
No, I'm not single. Next question.
All right.
So, Aaron, you're a CA. Where is the office that you are a CA?
The office is Life Chiropractic in Redondo Beach, California.
Cool. And what is your question today for James?
So my question is, of course, always chiropractic adjustments, but with bioidentical hormone replacement pellet therapy, is your protocol of the regular use of omegas and probiotics and vitamin D outperforming like the hormone imbalance?
Well, let's go back and talk about the hormone imbalance. And okay, so what's the rule? If your body can make it,
don't take it.
Take it.
Okay, so there are some uses for bioidentical hormones. So if your body can't make it, you had thyroid cancer and you don't have a thyroid, you know what I mean? Or you've had gallbladder removal and you don't create your body doesn't make those enzymes anymore. That might be a reason where you would take something because your body can't make it. So you need to take it, right? Outside of that, there is never, ever a time when you would ever get a long-term better result by pumping hormones in from the outside. There's a couple reasons for that. One is that it shuts down your natural pathways for that. But the other one is that it's not, remember, a human being is an ecosystem of about 100 trillion cells. All of those cells have to work together in an indissoluble union to create this adaptive, incredible life form, right? All of that is regulated by your subconscious brain. That subconscious brain has either been created by a perfect God, if that's your belief system, or it has evolved over a couple million years to perfection, right? Where it almost never, ever makes a mistake. What would make us think that we could regulate those 100 trillion cells better from the outside with a bioidentical hormone? At what level, at what time, right? Versus how that innate intelligence could do it, right? It just doesn't make any intuitive sense. So what I would say is the question itself is it's a really good question, but it's loaded. It's like, well, could you outperform that? Well, what's your outcome measure? Long-term health? Of course it can outperform it. Right? Could it outperform it if you don't have a gallbladder? No. So there is a time and a place for certain allopathic interventions, but they are never going to produce health, and they're never going to properly regulate the body from the outside.
Right. Well, the system's tricky, and the word, bioidentical, it's, even though I, research and I'm here and wanting to learn, it's sometimes you still get wrapped up in the terminology of, okay, that sounds natural, or is it natural? And just delving into, what it is and
well, if I take bioidentical testosterone, right? Mm-hmm. Or if you take bioidentical estrogen, what happens to your chance of breast cancer and cervical cancer?
Well, it's going to increase.
But it's bioidentical.
Right, right. It's such a different thing for what we know about men with, like, if you take testosterone, it's going to reduce testosterone. But on women, I feel like in our environment, it's, again, confusion keeps people confused and buying, and we just have, patience and things. And so it's just having that terminology and the answers to be able to be straightforward and focused and simplified to stay on track and not even have,
Well, the first question is, why do you think you need hormones? That's the first question, right? Well, I've been told I have an imbalance. I'm told I can't do it. Well, what proof do you have that your body's not capable?
Right.
It's like, what proof did you ever get that your body can't regulate its own blood pressure or cholesterol or hormones or moods or body weight or blood sugar?
Yeah.
There's no proof.
Right.
Zero.
Right.
They don't even run those tests.
Right.
Well,
So-
and the education you gave today, answered this question before, answering it. So I wish everyone watching this podcast would have been here for best practices, because it is just, you're incredible. So thank you for thank you for
The
doing
information
research.
is-
Time. If you want
And
to speak a little more, you
and
sure
like-
can.
No, but and
Why the
simple,
rush?
This is,
no, but like
this is
Another
obviously a
promotion,
genius.
please,
We got a
help
genius
yourself.
here. We got ourselves a
but,
genius.
So it's knowing the right people in the group, and everyone in here is, and the way you've simplified it, and it's like, not just simplified, but it became a no-brainer. And
It became self-evident, correct?
absolutely.
Because it is. Health is, these things are, the confusion is all these terms and all this stuff that allopathy does. But at the end of the day, health is so simple that our ancestors who didn't know what a cell was did it better than us.
Right. I would say humbly that a good teacher will make it self-evident. You did a great job today.
Well, thank you. But,
And also
but it is self-evident. It's
It
just
is.
it's getting the misinformation. I hate that term because what I mean, but it's getting the lies out of the way, and then when you do that, you come to your own conclusion quickly.
Yeah. That's right.
Right.
Just cut the bullshit, and then you get
Yeah,
right to the facts,
exactly.
and it's there. And it's.
Yeah.
But I think you're a great teacher, which is why chiropractors love being in the classroom, because you then take them on a journey where it becomes self-evident to them, because you cut away some of the BS, and then you fill it back up with the right stuff. So, and then for the people in the audience here, if you guys would just indulge me for a minute, just get on your feet. Erin worked the front door for us. She checked people in. She volunteered to do that. She bought her ticket. She came here as a CA.
Wow.
She's pretty badass. So if you guys wouldn't mind, just stand up for a quick second. Just give her a round of applause. Thank you, sweetie.
Yeah.
Thank you.
But if your body doesn't make it, don't take it.
Amen,
thank you.
sister.
Thank you.
Can I get an
Erin,
amen?
Erin Gillespie.
Preach on, Chef. Tell the truth.
All right, we've got Erin Gillespie sitting at the mic. Where do you practice?
Vancouver, Washington.
All right. What's the correct pronunciation of your last name?
Gillespie.
All right, cool. What do you have for us? What's your
What, did
question?
you have a different?
No, I think I said it right. I just want to make sure. Sensitivity to last name pronunciations. Yeah, I don't know where that came from.
I don't know. In fifth grade, I had a guy that called me Gillespie Cow Pie. So aside from that, it's Gillespie.
Right on. What's your question today?
So a surprising number of people, patients that come in, are taking NSAIDs, and a remarkable number of them actually have a very strong belief system that they're not only beneficial but have no harmful effects. And in trying to stay in rapport with somebody that you just met, I was curious how some of the best ways to communicate through more of a Socratic method of asking questions as opposed to, disagreeing with a belief system they have so strong, to communicate with them the negative and harmful effects of continuing to take those.
One of the great things I've learned from Brad Glowaki, and this was maybe at the Element of Closing one I went to in Vegas years ago. I can't remember, but anyway, it stuck with me, and it was stay in agreement. I'm a hardcore left brain, logical, fact-based dude. And as soon as I hear something that's not correct, I can't wait. Right? I'm like, whoa, finish your sentence, right?
Bullshit.
And usually I don't let them, you know what I mean? If it's an MD, they don't get to it, right? You know what I mean? But the first thing, with that now incorporated into my belief system, my first thought when you said that was, well, don't confront the new person. Don't confront the new person with that. You got lots of time. Stay in agreement, get them into the care plan, and then ease them out of it, right? And then you drop little hints like, this is why dentists don't just give NSAIDs, because they want to fix the underlying problem, right? You just keep dropping this stuff, and it's like you don't ever have to confront, and then eventually you'll have that rapport, and you'll have that authority, and you'll have that trust where you can then have the sit-down conversation. But I wouldn't do it right away.
Right.
right? Like your job isn't to get them off drugs. Your job is to get them onto your care plan.
Right on.
And get them onto the essential nutrients, right? That's it. That's the care plan. So I would just go, no need for confrontation whatsoever. And that's a pretty big grown up stance for me because
I'm proud of you.
Thanks, man. I'm
It's
still growing,
flexibility.
buddy.
Yeah,
I'm still
that's good.
growing.
I feel honored to be quoted. I would agree with that and just say, kind of what we teach at the Elements of Closing is you got to get their top priority because you'll get top commitment, right? So what is their number one thing? And then you'll get the most commitment. For the same is true of the chiropractor. What is your top priority? And it's not to be talking about pills and drugs. My top priority is to get them adjusted, right? So where do I rank getting them off of NSAIDs? It's important, but it's definitely further down the list. It's definitely not the first thing I want to do. I want to get them on a plan, and then we can start talking about all the other stuff because you go through that nurture phase. So I think it's really important that we have these conversations. I love your question. I just think very much like we teach with the patients, prioritize what they have going on. We've also got to realize what are our priorities. And too many chiropractors, they mistake, distraction for an opportunity. And a distraction could be talking about NSAIDs when the opportunity is putting them on a care plan. And so put them on a care plan first. We can get to the NSAIDs later. I've earned the right to teach them over visits. We can come back to that. But what is your number one priority as a listening doctor to the podcast? Put them on a plan. Earn the right to educate them over time. And the way you do that is you stay in agreement. Mm-hmm. You kind of file that away. And then when the time is right, you bring it up. And that question is a really intelligent question because it's not a probing question. If you ask the question why, people will oftentimes be offended. Mm-hmm. And then they go into what's known as a confirmation bias and they defend their position. Why are you taking that? Well, I need it. I got it. And all of a sudden it's like, but if you can just say like an analogy or something with dentistry and you go, have you ever seen a dentist do that? What do you think about that? That's a what question, a how question. But if it's a why question, you almost certainly will feel like you're attacking the person. And then unfortunately, when they defend it, they basically reinforce their belief system why they need more pills and drugs in the future because they're defending that. So really intelligent to just stay in agreement, put them on a plan. That's my third priority. Fourth priority, it's further down the list. I'll get to it, but I don't want to attack this person and say, why are you doing that? That's dumb. Because then they start to defend it and it reinforces an old belief system when actually we're trying to build a new paradigm. And so I think that's
and if you got a length of care plan, it means you're not in a rush to do everything. I mean, the young docs, other than Ryan, but the young docs all try to get everything out on the first visit. Yeah. Right? They're vomiting all over people and you're just trying to get them to change everything on the first day because, especially if you don't have a care plan, if you think they're around 3 visits. But if you're like, I got 90 days. Yeah. Relax.
I tell a lot of young docs, your first visit is not about justification. It's about having patience. Like you don't need to justify anything on the first visit. You just listen, have patience. But if they say something that's incorrect and you go after it and you don't need to justify yourself. You'll then miss the opportunity to sit down and go over the reported findings. So don't blow that opportunity.
Exactly.
Be patient. It's like just take your time.
One of the things that you talked a lot about today was the inflammatory process that is so present in most everybody. And if their belief system, and this was part of kind of where that was coming to, is as you get to that point where you start shifting that thought process between essential nutrients and what they have believed would reduce inflammation. When you talk about the fact that you've got too much inflammation, their belief system says this reduces inflammation. Right. Just kind of the simple process of when you get to that point of explaining that shift from the value and importance of essential nutrients, of course, the chiropractic care along the way, but how you shift that conversation.
Exactly. So it's not like the tap's on too full. When you turn your tap on full, is your sink drain? If your tap's on full, should your sink drain?
Yeah, it should.
It shouldn't overflow, right? If the plug's out. Right. But if you plug your drain and the tap's on the same amount, what happens? It overflows. You got huge problems, and that's the lack of resolving pathways, right? Is that you got the same inflammation if you get an injury all the time. You get that acute stuff is a lot of inflammation, but if you don't have any resolving, the drain's clogged. Mm. And NSAIDs don't unclog the drain. They actually clog it further, right? They just slow down the tap a little bit. But does it matter if you slow down your tap a little bit if your sink's full and your drain's clogged? No chance.
Love it.
That's a great analogy.
Yeah. Put your hands together for Aaron. Well done. We've got MJ Lewis. MJ here?
David Letterman.
We've got Matthew Noji. Matthew here? All right.
Nice.
MJ's out. All right, put your hands together for Matthew. Right on. In case you forgot your question, this is what got you up here. Okay, don't stray too far from the path. Never mind what the other people have done. One question per contestant. Just messing. That was mostly for Aaron.
So what are your 3 best recommendations to increase?
You're acting like you're reading the card. Did you write that card or not?
Yeah, I did.
Okay, all right.
Just gotta make sure. Speed during your patient visits.
Ask it again. I interrupted you.
Oh. What are your 3 best recommendations to increase speed during your patient visits?
Speed, so the daily visit, how to do speed. Number one,
Through your, your adjustment.
number 1, face down. Number 2, the less the doctor talks, the less the patient talks. And number 3, I would tell you, the louder, the more frenetic, the more that's going on around you. Like if you have an open adjusting area, I move more deliberate and slowly through the process. I don't act frenetic with it. So I guess the best way to answer that and summarize this is a quote from my dad, actually, which is, you've got to be the thermostat, not the thermometer. So when things are cold, you got to cook it up, and then you got to get your table talk going. You've got to be educating your patient as you go. But if things are busy and they're cooked up in the office, you got to be cool and just kind of put everybody at ease around you. Again, number 1, put them face down. It's really hard for people to talk and waste time if they're face down. If they're face down, educated mind is off, innate intelligence is open, you're kind of working in the right plane. But too many chiropractors start people in a chair, and that's perfect for conversation. My feeling is if we're talking about the daily visit, and that was the question, then I want them in an adjusting posture, not in a speaking posture. So start people face down, get their wallets and keys out of their pockets, and put their pocketbooks on a hook and somewhere, and they're ready to be adjusted when they're spine up and face down. And to me, that is probably the biggest thing for speed. And then also the doctor's energy. The less you talk, the less they talk. More checking, more adjusting, which is super efficient. And then again, if it is busy and you do an open adjusting area, I would just say be really deliberate. And when it gets loud in my practice, I lower my voice even further. And then all of a sudden, the people around me start whispering, "Oh, sorry, doc. I didn't know." Okay. And it just kind of brings that frenetic energy down, which helps you speed up. Because if it's frenetic, it's a lot of wasted energy. It's a lot of dissipation of energy with that stuff. So, yeah. What would you say about it?
I would say absolutely face down, but I would always train my patients before they got their first adjustment, right? Like I did, and once they've agreed to start care, I'd be like, okay, there's a few things we need to go over. So first of all, I'm going to show you how you need to be before I come in and adjust you each time from now on. I'd say, so everything out of your pockets, lie down, think of something for you're grateful, deep breathing on the table, 100%. Second thing that was I found really helpful for me was understanding that the value is in the adjustment, not the time. There's nothing you can say that's going to give them added value that you can't say during an adjustment. So the first thing you need to do is just find someone you like someone a good friend, your wife, whatever, and adjust them in a reasonably quick way, and then time it. And you'll find it's about a minute, right? It's about a minute, to be honest. And then you say to yourself, well, what if I gave myself 2 minutes? What did I do for the other minute? Well, you gave them a hug, you maybe try to get their watch, pickpocket them, whatever you got to do, right? But you got another whole minute, right? Yeah. And then sit there and talk for a minute and time it. It's quite a long time.
That's right.
So a 2-minute adjustment, if they're face down and you realize how long it takes to adjust somebody, it's about a minute. And then you just admit to yourself that you're not selling your time, you're selling the adjustment. Mm-hmm. And all of the value is in the adjustment, and whatever cool thing you can anchor to that adjustment within that adjustment window. And then when you do that, you'll realize that you're wasting their time, right? Like, just nobody wants to have their time wasted. And if they're so bored, they really want to talk to their chiropractor, they got other issues.
That's right.
Right?
I mean, honestly, the people you don't want in the practice, right?
It's and they're the ones you don't want to talk to, right? The interesting ones want to get the hell out.
Yeah. Yeah,
right. Like you'll see them at the pub or see you later or whatever.
It's like the old Spicoli line, "Isn't it our time, Mr. Hand?"
Yeah.
So, but I would also say, so it's a similar thing in my practice. I just have my CA teach them that.
Oh, yeah,
so
perfect.
I do it after the report finds, and the next
Yeah.
visit my CA reinforces it.
Of course.
We don't have an issue with it. So
Right.
100% agree with you on that. And then the other thing is I've got a friend that's a dentist, and we brought up the time issue, and he goes, "Look, man, it's the same thing that we do." He goes, "I can pull your tooth nice and slow, or we can get it done quickly. What would you prefer?" Makes a lot of sense.
More drilling time.
Right, yeah, please.
I love the smell of that tooth. Could you just increase that a little bit?
Yeah, no, said nobody ever, right? So the idea is people usually want speed versus time. And the people that would love to spend all day in your office, you probably don't want them in your office all day.
And a really big one for me was I went to observe somebody who was very busy. And I sat there. There was an open concept. It was actually in Honolulu. And they had an open concept, so people sat here, and then he'd adjust somebody, and then you give them a little hug, and then go over and adjust somebody, and then the other person knew they were in their hot seats, and they knew how to, when they were going. Rotate. And he's like, "How many people do you think that was?" I think it was like a 2-hour afternoon shift, and I'm like, "I don't know, you must have seen 30 people there or whatever." He said, "Dude, that was 120 people." And I was like, "No, it wasn't." And he goes, "It was." He moved so slowly. Yeah. Right. He would just. And so the big thing is go observe somebody, get to Brad's office, get to somebody's office who actually has very quick adjusting. And what you'll see is exactly what Brad said. They're slow. Yeah. They just move so methodically and slowly that you can't believe they're getting through that many people.
So when we have docs come into my office and we do observation weekends for 3 days, I'll always have a counter. Because we first did it, people were like, there's no way that was really the number. So now we actually have like a clicker that they actually count the patients as they come in. And I said, I'm not paying attention. I'm just in the zone and I'm just loving on people. And they count and then they come up with a number. And it's pretty impressive for people to see it. We blew out a wall in my practice. It's got a one-way mirror. People can literally watch. My patients know, they sign the HIPAA agreements. I'm going to wear a microphone and it's piped in so they can even hear it, because I think seeing is believing.
Agreed.
Just having that ability to see it, and it's like, oh my God, like, okay, so what was your interpretation? It wasn't frenetic. It wasn't crazy. People didn't feel stressed. It's like, that's how it has to be. Slow is fast.
And the cool thing for me was the patients got huge value, right? The biggest shock for me was the patients weren't wanting it to take longer, and then all of the added value of stuff came after the doctor's time. Yeah. So they went out, they got a CA, they got information there. They had a bunch of apples there that people could get. There were a bunch of handouts they could get, a bunch of information. It was a phenomenal health experience for these patients. But the time with the doctor was 2 minutes.
Yeah, love it. I love it. Where do you practice?
Lethbridge, Alberta.
Right on. Alberta, Canada. I know where Alberta is. You felt like you had to tell me Canada at the end of that? Alberta, Canada.
I know what you're talking about, buddy.
Had enough of this guy. All right, thanks for coming, brother.
Good to see you.
All right, put your hands together. All right, we've got Justin Jesperson. Justin, are you here?
Yeah.
All right, put your hands together for Justin. I'm just going to lean a little closer on this. So I was talking to Justin today at lunch and found out you are a third-generation chiropractor.
That's right.
So you're practicing in your grandfather's practice, which is where your dad and your uncle?
My grandfather opened his practice in San Diego.
And how many years ago was that?
In the late 50s.
Wow.
Father.
Yeah.
That's awesome.
So I practiced. So my dad graduated, and then my uncle behind him graduated. And so the three of them practiced, and then eventually it was my dad and I.
That's
and
cool.
then I got out of California, and now I'm in Nampa.
Right on.
Yeah.
So are you here to tell us stuff right now, or are you here to ask questions?
You're asking me the questions, I guess. So. Well, my question is very similar to one of the other ones that you had about the fire and the passion of chiropractic and how you keep that going in your life. Mm-hmm. So I can maybe ask another question if you want to.
Let me throw the question back to you.
Yeah.
How did your grandfather do it? What did you observe of your uncle and your father?
My dad's been grinding for a long time. He's been going. He just turned 70, and he has the purpose of chiropractic in him, and that's what keeps him going for sure. And my grandpa, the same thing. He lived to be 100. He died in 2020, and he same thing. He had the passion of chiropractic going, and he also knew that he was connected with other chiropractors in the area, and so he knew an upper cervical doc that. My grandpa could fix almost anything, but if he couldn't, he sent it to upper cervical doc. And anyway, so he's really well connected with chiropractors in the area, which is
Let's
cool.
talk about that concept for a minute, just referring to other chiropractors. I wish that was a thing that was more common in our profession.
Me too.
You know, we've got a pediatric chiropractor in town, does ICPA certification, anything that's out of what I do, I send to her, and she does awesome and get a nice thank you card. And it's like, yeah, I know what I'm good at, and I know what I'm not going to be doing.
100%.
I just send it to somebody else in town. I don't know why that's super hard to understand.
I think a big reason, Brad, is that if you're starving, you can't give up a patient. You're afraid to refer somebody out. And you know, when you're living in abundance, it's really easy to go, you know what, they're kind of better at that. Or, you know, I definitely can't refer you out to something other than chiropractic, because that ruins your chances and probably will ruin your life. But you can certainly try a different chiropractor or a different adjusting style. Like, so I'm going to refer you down the road. Like, MDs don't refer people you know, to chiros. They refer them to other MDs, right? And that's what chiropractic. We have to create that sort of trust in each other. But I think that starts with what we did today, which is showing what's that bullseye. Yeah. So if you know you're going to refer somebody to somebody who's for sure going to adjust, right? Follow these protocols. Yep. You know what I mean? Either recommend the nutrients or sell them, whatever. Either one. You just got to tell them about them. Right. You know, and do that kind of stuff. I think you're much more comfortable. But most chiropractors are afraid of what someone's going to get when they refer to another chiropractor. Unless they know that chiropractor personally, they're actually slightly afraid. And sadly, that's somewhat justified, you know? Yeah. And so, yeah, I would just add one thing that I didn't mention when Ryan was talking about it, is that, you know, read something cool about chiropractic or health, you know, at least once a week. You know, just keep reinforcing how right you are. And I think that's really, really important, because it gives you that little extra boost, which is, you know, every little thing that you read, like, even if it's, you know, I don't want to self-promote, but, you know, whatever, like, you go buy a research article or get one of the research reviews or watch one of the classes.
Everybody should have your book. You're not self-promoting. It's a great book. I mean, it's just like everybody needs to have that, right? Like, eat right for your species type.
Yeah, you can read a couple pages a day, but it just keeps you in there, and they're so full of evidence that you're right. Yeah. And I think that does help, right? Because everything else is telling you you're wrong.
Yeah. And I think it wouldn't be a Chiropractor podcast if we didn't say, and once again, chiropractic is right. You know, I mean, it's just huge, right? And so, and I think also with some of that, to stay on fire, it's to be around other chiropractors. So get yourself to events. That's why we hosted Best Practices, to put people in the room that have like mind. You know, when Cal Jam was first starting, sat down with Billy D and went through some of that stuff, and it was just like, hey man, this is really to get the passion and get people re-dipped. And you know, there's chiropractic schools that host the events. Life West, The Wave, it's like, you know, they said it would never work in August. People came out in droves. So don't underestimate the value of the fellowship either. I think that's huge. And the fact that you had two uncles and a grandfather, like your family was the camaraderie that you had, but for everybody else, the goal is just to stay off the island and mix it up with other people. I think that's a huge part. We call it the flea dipping. You got to get re-engaged. But once a week, I listen to something on health on YouTube, to your point, and then something from a TED Talk. And sometimes it's not super positive. It's the other side of what they're talking about. And I go, okay. I came across a clip of Bill Gates talking about, you know, population control through vaccines, and I was like, hey, this is going into the next seminar. You know, it's just sometimes it fires you up too. So yeah, YouTube TED Talk once a week. Commit to it.
Brad, if we can't rely on a computer programmer to run our health system, something's wrong.
He did stay at a Holiday Inn last night, though. You know, it's just like, I'll go too far down the bunny hole. But the point, I think, is just staying around like-minded chiropractors who are going to lift you up too, and not bring you down, and finding that tribe, and just staying consistent with it. You know, just staying consistent with being around the people that are on fire. Stuff in the hallways here at lunchtime. I think that's super important.
Yeah, I think I speak for everybody else. That what got me here was the podcast. So you need to have more podcasts, the two of you talking with each other.
Right on.
I mean, that really, of anything, that's fired me up a lot, because I think for me, the research, it doesn't work for everybody, but the research is what really gets my confidence, my certainty, so that I can speak that way to patients, and then knowing what I'm doing is right, and knowing what I'm doing is going to save lives. So
I'm going to tell you a shocker. I was in South Dakota two weekends ago, and what's the name of the little town there, where Wyatt Earp got shot? Deadwood. Thank you. I don't know why I forgot. I get on low blood sugar. I'm not drunk. And I asked them to raise a hand how many listened to our podcast. 0 hands went up.
Oh wow!
So I'll tell you.
The name of the town is Deadwood.
Yeah, I know. Hello. Yeah, I hear you. No, but I mean, but these talks were on. Like they were on. But what I'm asking you is that if you appreciate the podcast, please spread it out. Like, it's free. Sure. So just send it out and share it, because I was just like, are you kidding me?
Yeah.
But it's like, nowadays, how are people going to find out about it if no one's sending it to them? And it's not like we're asking you to sell something.
Right.
We're asking you to give
Copy,
something away
paste the
free.
link, give it away for
Exactly.
free.
Yeah. So I would.
And part of why we wanted to do this live in front of everybody is like there's very little prep work that goes into this. It's just a deep passion, and we've put years of the camaraderie, the fire building, getting together and doing that. So it's kind of fun in this format to just share it openly because it's like more people need it, And we've had other comments like yours where it's like you guys should do it weekly. So just for anybody else who's coming up here, if you come up here and give us more shit to do, your question's going to get canceled. I'm done with this guy. Thanks for coming up here, brother. Appreciate it. All right,
Thanks, man.
All right, Dan Martingano. Dan is from Florida. Dan, you still here?
Dan's on his way to Florida.
Dan, boo. All right, Marley Noji. Is Marley here? All right. Well, those are the only questions we had pulled.
Well, we can take the cameras in there.
Anybody have a burning? We have time for one more question, one and one only.
There's
Who's got
one.
a burning question? Eric, come on up here. Yeah, buddy, I got one. Let's put your hands together for Eric.
Yeah.
Just for the camera, that's Dan. Marley's nice. We'll be next to him.
Those lights are legit. Yeah. All right, here's my question. So
I like the uncomfortable. Yeah. Come closer to the mic. Let's speed this shit up.
He's a little bit scared because I choked him out last seminar.
He did. That's will stay between us, though.
Yeah.
Here's my question. So yesterday we talked a little bit about my dad. He had dementia at 65. What would you say is the recipe to stay away from that? His parents had it too, supplemental wise. Is there anything I could do?
Well, dementia is type 3 diabetes. It's definitely a very, very, very highly related to chronic inflammation over years. So honestly, the best, there's no, I mean, there are some things you can do when people already have dementia, but by far the best, the best way to deal with cancer is not to get it, right? The best way to deal with dementia is not to get it. So dementia is on an exponential rise recently. I'm sure everybody's aware of that, but there's been no gene change. So why is dementia on an exponential rise? Well, obviously because of the seed oils, because I could just go on and on about it, right? High sugar diets, all this stuff. So honestly, the best way to stay away is just to live, to follow the exact protocol we're talking about for any other chronic illness, which is, stay moving, get adjusted, get exercising, do the essential nutrients, eat decent food, stay away from the toxic, inflammation causing, high sugar causing foods. Get your mind right in terms of gratitude and positive thinking and all those things. But that's a panacea, right? Because all chronic illness is caused by unhealthy lifestyle. So the answer to everything is healthy lifestyle. Everything.
Yeah. And it's kind of fitting that Eric, of all the docs here, volunteered to come up because we're going to kind of stitch the Q&A session here with what we did yesterday. And actually, who we were talking about was Eric and Eric's father. So just to kind of put a name and a face together. And if I give people a hard time up here, it's just because I like them. So get ready for this. No, but the truth is, just a sweetheart of a dude, a phenomenal chiropractor here in Utah, but lost his father too young and opioid addiction, and definitely had some what I'm going to call brain wasting diseases. And for the docs listening, that's a really good topic you can talk about in your practice. Brain wasting diseases, how it has a deterioration of the neurology in the body, what that manifestation looks like, what the false manifestations look like. There's a whole bunch on this topic, and it's of major interest to predominantly male patients because that is a big quality of life issue for men is mental health and stability and not having things like Alzheimer's and ALS and a number of different things that are going on. These category of brain wasting, it's a quality of life issue, and yet it's really prominent. And so to set up a lecture and talk about this stuff with seed oils and what you need to do, and as much as it's a tendency to say don't do this and don't do this, to your point and your question is, well, what do I do?
Yeah, I think the best topic of any talk is how to avoid getting sick and to stay well, or how to get and stay well, or how to, you know what I mean? Anything like that, because that opens it up and that's interesting to everybody.
That's right.
Right? How to avoid all the common chronic illnesses and how to get and stay well. A topic like that allows you to talk about your protocol.
That's right.
Right. So you're going to throw in the adjustments in there, obviously, but you're going to go and throw in the nutrients and the healthy chiropractic lifestyle. But that topic is an invite to everybody.
Yeah, and you want that. You want to open up the lens
Yes, you
and pull
do.
people in.
Yeah.
And to me, we've done this exact topic, and part of it is we get to talk about upper cervical subluxations and how that diminishes the body's ability to do it. We can talk about things that are off the spine but affect proprioception. We can then talk about proprioception back up to the brain, so you can get into the safety pin cycle. So, but it's in a way, to your point, where people are interested. So number one, it's well attended, and number two, you can convert that to a chiropractic talk. And those are two major criteria for any talks as far as I'm concerned. Will it be well attended, and can I make it a chiropractic conversation?
Right.
You know,
Right.
and if it can't be, then we can always pull it back to chiropractic, but if it's too much of a stretch, I just don't want to cover it because I need to give them a solution. And if the solution is come be a new patient, I feel really good about it. But if I go and educate and don't give them an action step, I just feel like that's improper to do that. It's just bad taste. It's not polite. If you're going to provide the problem, offer a solution. And if that solution is a new patient appointment, those are the topics that do well. And that's a really good topic.
Yeah. Do you so like with me, my grandma had dementia on the same side, right? So did my dad at 65. And so I'm 45 and I do that math, and that doesn't sound very fun to me, because the window could be, closing in on me quicker. If there's a gene, let's say they say the gene turn on, I saw your look, so you already know my answer. So my diet, exercise, all that routine can like totally diminish the fact that even turning on that gene, if there was a gene.
There's no gene.
Okay. That's what I
Okay.
thought you
So,
were
and
saying,
if it was a genetic illness, how could it be increasing in prevalence?
that's a good point.
It's not possible, right? Human gene change, right? Chronic illness prevalence.
Right.
Human gene change, chronic illness prevalence.
And for those people listening, flatline statistic with the human gene change.
Yeah,
There is
like
none.
there's none
Chronic
in
illness going
20,000 years.
through the roof.
Right. So what else has changed? What's a change that's correlated exactly with the increase in chronic illness? And
Diet, exercise.
well, lifestyle, but chronic inflammation, immune dysfunction, right? High blood sugar, metabolic illness, right? So the cool thing is that if the problem you're telling people is explaining to them why you get sick and how to avoid it, that's a really good topic for a talk. Why you get sick is chronic inflammation. Why you get chronic inflammation is because of the seed oils, because you're not moving properly. All these things. What's the solution? My exact protocol. And here's what's interesting. Honestly, think about this for a second. What other protocol out there and anywhere in healthcare is going to resolve the actual underlying cause of all of the chronic illness pandemic? If it's chronic inflammation from lifestyle and not moving, right? What other protocol out there has any chance? There isn't one.
Right.
There just isn't one. So your protocol literally addresses all of the reasons why people are getting chronically ill.
I like this guy.
Oh, I love the dude.
pretty
Yeah, he's awesome. And again, we just been teaching for 2 full days. If you never have done a workshop, there's setup, there's breakdown, there's teaching in between. You can be pretty haggard at the end of it. And the dude's hanging in here like a champ, just slinging information on a free podcast. So I'm going to take this opportunity to just say, hey, in the audience, if you guys wouldn't stand one more time, we'll stand up. I'm going to have James Chestnut take a bow. Let's put your hands together. Jimmy C.
Now, before we do this, let's remember, with slightly less enthusiasm, could we give Brad a small
He was offended by your round of applause last night. I'm going to stand up and take that one. Not the spotlight. It's too bright for my eyes. Hey, this has been a fun episode of the Chiro-Factor. And for everybody here at the Best Practices, we appreciate it. We're coming next to the UK in February of 2025. And then I think we'll be in Australia 2025, probably the month of March, but we'll be announcing that. And for everybody here, we really appreciate your time and energy. Thanks for clapping and cheering on and offering your questions and just everything. It's the first workshop we've done. We would always anticipate there's problems or glitches or issues, and we didn't have any. And I think a lot of that has to do with the people here. So this is not at all a dress rehearsal for us. We took this very seriously, and I would say it's pretty flawless. So that had a lot to do with you guys. So thanks for being here. Thanks for trusting us, and we hope to see you again soon. Appreciate it. Thank you.
Thanks,
guys.
everybody.
So again, Best Practices 2025, we will be in London on the 7th and 8th of February. Best Practices Seminar 2025, James Chestnut and I will be teaching in Australia on March the 7th and 8th. If you want more new patients from talks, then you need to join me for the Speak to Attract Believers workshop that I teach. And I'll be doing that in Australia at the end of 2024 with Dr. Martin Harvey, who's one of my good friends. He's a communication genius in his own right, but the two of us are going to come together to teach docs how to do corporate talks. And I invented the 10-minute talk. I invented it for my own practice, and now I'm teaching docs how to go out and actively get new patients in their community. And post-pandemic, this is the time to do it. My guess is, in a couple of years, that space is going to get really noisy again, like it was pre-pandemic, where there's a lot of different kinds of doctors out there teaching and sharing their message. So get on this. Speak to Attract Believers. When you buy it, you have access online immediately. There's hours of content. And then you also get a seat to the live workshop where I'll help you build your talk. We spend a good 90 minutes showing you how to get into more places, how to book more talks. So again, over an hour of content is how to book more talks. You'll come back with a diary, a schedule full of health talks in your community. And if you can master the 10-minute talk, which you will at this workshop, then you'll find 10-minute talks are easier to book than even 60-minute lectures, because the less time you need, the more places you can get into. So join us online or in person. One ticket, you get access to both for Speak to Attract Believers. James and I are going to be in each continent once per year, so please take advantage, or you won't see us till the end of 2026 for the Best Practices Seminar. Levelupmentoring.rocks. It is not a .com because it rocks. Levelupmentoring.rocks is where you can purchase your seats for all of this, and a good prerequisite to the Best Practices is our Elements of Closing workshop, where I teach people how to do a day one consult for value. And it is the best report of findings in the profession. Voted #1 in the profession for a day one consult and report of findings, driving value in a vitalistic manner. All these procedures and science and evidence pieces that we cover, I've turned into procedures in the practice. So if you want a good prerequisite to the Best Practices Seminar, go to the Elements of Closing seminar, and I'll be teaching you the strongest day one, day two in the profession. Put people on care plans for the right reasons, and then you'll actually be keeping them, which is what we do better than anybody else in the profession, having patients for life. Happy to say that because we know chiropractic saves lives, it gives lives, and that's what we're doing at that workshop also. I know it's a lot, but hopefully you are enjoying the content we lay down. Many people are messaging asking for the next steps. Those are the next steps. Speak to Attract Believers online and in person to get talks and new patients in the door. Put them into care plans, Elements of Closing workshop, and of course, James and I teaching side by side at Best Practices. You'll be building a wellness practice real soon. I'm here to help you out, and anything else I can do, please let me know. But this Chiro-Factor in particular, in front of a live studio audience, was a blast to do. That's what we're going to do in Australia. You need to be there. That's what we're going to do in the UK. And if you're in attendance at the seminar, you will also be on the podcast. Cheers, everyone. Until next time, there's many factors in health. There's many things that will help people get healthy. But I believe the X factor is the Chiro-Factor. Thanks for joining us.
Man, the podcasts are really exciting. They get you fired up. They just get you back to being level. But coming to the Best Practices has just been really amazing because you get your questions answered and they're on fire and everybody's excited. Got like-minded people trying to just do better for the population. So I can't endorse it enough. Come to the Best Practices. I also love sitting on a live podcast because you can really see the two grind. It's not scripted. It's just fun, organic, and original. If you get a chance, listen to it.
Best Practices, awesome, man. It's if you're talking about increasing certainty, if you're certain in the procedures, getting here and listening to Dr. Chestnut is going to kind of unleash the dog. And I can say, like, after this, I'm excited to go back and really turn this thing up. Just having all the certainty, having the research, and being able to back everything that I've been saying for years. It's awesome. And also podcast, incredible. If you haven't listened to it, making sure you listen to that Chiro X Factor, and then just sitting in on one this weekend, super cool. Answering questions right from the audience, really diving into that next level of certainty of not only on the chiropractic side, but what else can we help them with, how else can we support them outside of it, and how do we make sure they stay out of the allopathic model. Like that's really what it's all about. So if you haven't been, make it here.
Hey guys, I'm sure most of you listen to the Chiro-Factor podcast. I just want to let you know that we're here at the Best Practices Seminar, and it takes it to a whole nother level. So get there. It was super cool last night. We got to be part of the live audience for their next podcast. So I can't wait for you guys to experience this as well.
I'm a chiropractor assistant here in Utah at Best Practices. I've seen the Chiro-Factor, which is awesome, that podcast with Dr. Glowaki, Dr. Chestnut, but there is nothing like being in person and seeing this live, hearing the information as it's coming at you, the energy, it's just so amazing. I highly recommend come to these events because there's nothing like it.
I'm here at Best Practices with Brad Glowaki and James Chestnut. This has just been more than I expected, more than I anticipated. I came here today as 27 years in the trenches. I feel very confident in my heart about chiropractic care. Of course, I love it. I see the results every day. But to be honest, I kind of lack the confidence and the swagger to go up against kind of the research, and chiropractic is lacking in research, and medical doctors are saying this. I always felt a little bit inferior on those conversations. Leaving this weekend, I'm gonna walk into my practice Monday morning with a cape and a swagger that I did not have before. I'm just gonna knock it out of the park. And I wasn't expecting, we got to see the podcast, the Chiro-Factor, live and in person. So we got to sit in on that and ask some questions. It's just been a great weekend overall. And as always, it's great to connect. And Brad Glowaki always over delivers. So I appreciate it.
I've been following Dr. Chestnut stuff for a while on my own, reading and learning. Always loved his stuff. Came out with the podcast. I was like, oh, this stuff is really, really great stuff. The synergy between those two. When I heard about the seminar, the best practices, I just immediately like, that's where I want to go. And just being here is way better than you think it would be. All those extra questions that come up, and especially between the two, you just get it. They just cover it all. It's just, I'm so glad I came. It's super amazing so far. When you get to hear the podcast, you hear them, I'll listen to them in my car, things like that, but we actually got to sit in on the podcast last night. They were actually doing it live right in front of us, and really, that was kind of mind-blowing. I've never seen one done, and just to see it live like that and really be part of it, it was awesome. I love that experience. It was great.
Enjoying this wonderful seminar this weekend. It has been excellent. It has got the fire going again in you. It has answered a lot of questions for me in terms of nutritional supplementation for my patients and the things that we can do that we're not doing in our practice right now.
Yeah, I've always enjoyed listening to Dr. Chestnut. I've done other seminars with him, and his ability to take information from the research and make it digestible is amazing. And that's something we can implement every day in our office and make our patients' lives better.
Absolutely.
Worth every minute.
Yeah, worth every minute. Absolutely love it.
Here at the Best Practices workshop this weekend in Salt Lake City, Utah. And man, I've been listening to the Chiro-Factor podcast. It's been amazing. But man, being here live and in person, it's just really cool because you're able to get all your questions answered. It kind of takes it a step beyond what you learn in the podcast. And we've really learned how to implement the Level Up mentoring systems, coincided with what James Chestnut has to share with his wellness protocol. Been phenomenal, really, really good weekend. I'm looking forward to more to come.
And if you want to get sneak peeks of these podcasts before they drop, then follow me on Instagram at Dr. Glow DC. That's my handle on TikTok, Facebook, and again, Instagram, Dr. Glow DC.